Let me talk about the specific phobia. Phobia, also known as irritational fear. So, excessive or extreme or irritational fear or panic reaction about a situation or any living creature or any place or any subject. All is the specific phobia. Specific phobia is an anxiety disorder. It is characterized by an extreme or unreasonable and irritational fear that associated with a specific object, specific situation, or concept which poses a little or no actual danger. So it is irritational fear to or of any object or situation that persists, and specific phobia associated with any panic level anxiety if object, situation, or activity can not be avoided. So, generalized anxiety level means if anybody persistent or excessive worrying that causes the physical or psychological symptom, and defense mechanism commonly used to include the repression or displacement. So a specific phobia is an intense or irritational fear of a specified object, they said, right? So here's some type of phobia. A phobia basically is an excessive or overwhelming fear that result in avoidance or extreme distress. Some phobia are centered on a specific fear object, while others are complex and try to differentiate situation or circumstance. Basically, phobia affect about 90 million adult people, and women are 2 times more likely than men to have a specific phobia. Even some people experiencing multiple specific phobia simultaneously. And some studies said approximately 75% of people with a specific phobia fear more than one object or situations. So here's some type of phobia I'm going to explain. If anybody has a fear to height, it is called acrophobia. If anybody have a fear to open space, called aerophobia. So agoraphobia translates to fear of the marketplace or anxiety caused by public transportation or open spaces or any crowd of public or people being outside the home. They feel fear when they outside to the home. It is the character of agoraphobia. So specific phobia are the anxiety produced by a specific object or situation. Example, somebody has a phobia to electrical storm astrophobia. Somebody has a phobia to blood, hematophobia. Somebody has a phobia to water, hydrophobia. So specific object, even situation like fear of being alone, monophobia. Sometimes some very young children have the phobia being alone from the parents or caregiver. Somebody has a phobia to bacteria, parasite, organism, antigen, pathogen is called mysophobia. Somebody has a phobia to darkness situation. Somebody has a phobia to elevator, in elevator, claustrophobia. So doctor tell go for CT, CAT scan or MRI. You have a phobia, claustrophobia. You have to tell fear of closed space, claustrophobia, or achondrophobia. So even somebody has a phobia to social anxiety disorder, social phobia, fear of situation in which one might be feel discomfort. So anxiety caused by the social situation due to the fear of humiliation or rejection. Somebody has a fear to making a fool of oneself, criticized. Fear of stranger, xenophobia, and fear of animal we call zoophobia. So what is the treatment of phobia? Definitely, treatment is a behavioral therapy, maybe systematic desensitization or medication like benzodiazepine. So intervention, before to start intervention, if you ask me how you diagnosed somebody has a phobia, for diagnosis we use DSM-5 criteria for a specific phobia diagnosis. So if fear and phobia are not the same, let me recap it. A fear and phobia are not the same. So it is important to know the difference about fear and phobia. Many people experience the fear or aversion to object or situations, but this does not necessarily means that they would be diagnosed with a specific phobia. The therapist cannot use a lab test to make the decision, so they and other mental health professional consult with DS5 criteria. DSM means Diagnostic and Statistical Manual, usually fifth edition. So means according to DMS criteria, there are some criteria like excessive fear, immediate anxiety response, avoidance or extreme distress, life limitation, 6-month duration, all is the principle of criteria. So what is the intervention? Identify the basis of anxiety, allow the client to verbalize the feelings about the anxiety and produce the object or situations. And frequently asking about the fear object is the first steps in desensitization process. Also, educate the relaxation techniques such as breathing exercise, muscle relaxation exercise, visualizations, or pleasant situations. Promote the desensitization by gradually introducing the individuals to feared object or situation in small doses. Always stay with the client experiencing anxiety to promote safety and security. Never force the client to have contact with the phobic object in situation. So we said behavioral therapy can work and medication can work, particularly benzodiazepine.